Hi, my name is Mark Frattini, and I'm an attending physician at New York-Presbyterian Columbia University Medical Center. I'm also an associate professor of clinical medicine and the director of research for the Hematologic Malignancy section at Columbia University College of Physicians and Surgeons. Novel therapies and new clinical trials are really at the forefront of what we're doing here at New York-Presbyterian. And the main reason for that is the anti-leukemia therapy has been the same for about 30 years. And for the upfront patient coming in with acute myeloid leukemia, or AML, they receive the same therapy that people did 20 years ago as a quote-unquote standard of therapy. And so we know how that works, and unfortunately there's only about 60% of the people respond to that. So the challenge out there is to get more drugs into clinic to help improve that response rate. My laboratory research in terms of the field of leukemia is really twofold. So about 8 years ago, I discovered a candidate drug basically through my interest in how cells duplicate and how they divide. And we actually pinpointed the very initial steps triggering this specific process. And by doing this, we were able to show that we can kill cancer cells preferentially to normal cells. And so the logical progression is to take this into people. And so that is a very long process. It's taken about 5 years. The other aspect of my laboratory actually looks at how best to define new therapies for patients, or how best to choose the drugs that we currently have available to give to these patients so that they can get their best response. In some cases, this is trying to get them into remission up front. In other cases, this is trying to get them into a remission that will allow them to go to the bone marrow transplantation, because allogeneic bone marrow transplantation is, for people with relapsed leukemia, is their only real course at sustained, being able to respond and have a significant survival. I think patients should come to New York-Presbyterian to be treated for their blood cancer, specifically because there is a team of experts here. And that team of experts will start working with patients as soon as they walk in the door in terms of treating whatever the underlying blood disorder is, to ultimately taking patients to a bone marrow transplant if indeed that is required. So it is complete and comprehensive care from a group of expert physicians at New York-Presbyterian.